Good evening to all of you, and thank you for joining us on 13 Plus. I'm Mary Coleman. Hope your week is off to a great start. Hey, last Monday of the year. Well, when we go to the doctor, we trust the problem will be diagnosed and treated as quickly as possible, right? Well, as our national investigative team found out, more than 10 million people are misdiagnosed every single year. Here's what you need to know to hopefully prevent this from happening to you.
We trust doctors to tell us what's wrong when we're sick or in pain. I'm Lee Zurich.
And I'm Tisha Powell, but some doctors can get it wrong. As many as 12 million adults in the U.S. are misdiagnosed every year, but women bear the brunt of that statistic. They are 20 to 30% more likely than white men to be misdiagnosed, and in some cases, the mistake can be deadly.
Investigative reporter Kristen Crowley takes a closer look at the problem and what steps experts say you should take to avoid a misdiagnosis.
Every story has a beginning and an end. For Allison Lackey,
I'm cancer-free now, and it could have been a very different story.
She nearly missed out on that happy ending, all because of how her cancer journey started. To understand what happened, let's go to chapter 1, beginning with her doctors.
What did they tell you when they diagnosed you?
And my sisters were both in the room with me when the oncologist comes in and tells me the pathology report that, yes, triple negative.
Diagnosis: triple negative breast cancer.
Triple negative is very serious.
Yeah, the survival rates of people with triple negative versus not triple negative, yeah, there's a definite more serious diagnosis when it's triple negative.
Allison's next step became almost like a choose-your-own adventure. Go forward with the specific chemotherapy for triple negative breast cancer or get a second opinion. She chose the latter.
Looking back now, what are your thoughts on deciding to get that second opinion?
I thank God I did every day.
Chapter 2, that second opinion at the University of Kansas Health System changed the course of her story.
Were you triple negative?
No.
It was wrong.
It was wrong.
Allison had breast cancer, but since it wasn't triple negative,
that's a very different type of chemotherapy regimen.
Allison's doctor, Jamie Wagner, says had she been treated as triple negative, the chemotherapy likely wouldn't have worked. Allison might still have cancer today, and her case is not unique.
How often are you seeing that the initial opinion got it wrong?
Specifically for breast cancer patients, 43% of them will have a change in their diagnosis and treatment when they get a second opinion at NCI designated cancer center.
Almost half.
Yeah.
The problem with misdiagnosis isn't just with breast cancer. A 2022 study found stroke, sepsis, lung cancer, and colorectal cancer were among the most misdiagnosed conditions. Johns Hopkins estimates nearly 800,000 Americans die or are permanently disabled by diagnostic errors every year. And the statistics are dire for women, who are up to 30% more likely to be misdiagnosed.
How does a misdiagnosis happen in the first place?
Lots of studies across all of medicine has shown that those that have higher volumes, specialty training, their eye just becomes attuned to small nuances that maybe somebody else, they just haven't had the experience.
For example, specialists in cancer, infections, or neurology could recognize something a primary care or family doctor might miss. There's also gender bias. For centuries, clinical research focused on men, even though certain conditions can affect men and women differently, like heart attacks. One study found women experiencing chest pain waited 11 minutes longer for help in the emergency room versus men with the same symptoms. Allison Lackey's wait for the correct diagnosis
I was able to see the oncologist, the breast surgeon.
came within a few weeks. But for Sarah Allison,
how am I standing here with this diagnosis that I asked you about for 10 years?
it was much longer.
My migraines changed from being very responsive to migraine meds to not being responsive really at all.
She says she pushed her doctors for years to look deeper. Their response?
He just said, no, Sarah, it's not. There's no way. It's migraine, this is typical for migraine.
Even when things started to get worse,
Changes in vision, falling over, weakness, trouble with my hands, pins and needles, neuropathy.
she says her doctors still blamed it on migraines. But it wasn't a migraine. A second opinion 10 years later determined it was multiple sclerosis, an autoimmune disease that can be managed, especially with early treatment. Sarah missed out on years of that.
I feel like I was kind of dismissed at every turn.
And that medical malpractice attorney Robert Kingsland says is at the core of the issue.
Often it's the case with failure to diagnose and failure to make a timely diagnosis. The patient will have a feeling they weren't really listened to.
Kingsland has worked on failure to diagnose cases for about 20 years with his firm Dempsey, Kingsland & Osteen in Kansas City. He says he gets roughly 3 to 5 calls a week from people asking him to take their case. Typically, he says the failure starts with the primary care physician not recognizing a condition outside their expertise.
If you need a specialist, it's the primary care doctor's responsibility to understand that need and get you to whoever that might be.
That's why Dr. Wagner says whenever a patient is in doubt about their medical treatment or diagnosis, to ask questions, search for a specialist, and...
Do you encourage people to get second opinions?
Absolutely.
Even if you're the first opinion?
Absolutely. Yes.
For Sarah and Allison, second opinions changed the course of their stories. Stories they hope help other women from being misdiagnosed.
Dr. Wagner says when looking for a second opinion, try to find a health system with equal or better quality than the first one you saw. For example, if you're experiencing back pain or headaches chronically, you may want a neurologist because they specialize in those areas. And Wagner says, don't be afraid to get more opinions than just 2. You should feel like your doctors are listening to you and taking your concerns seriously.
It's not just women who face discrimination at the doctor's office.
A 2023 survey revealed nearly 20% of Black adults and 10% of Hispanic adults experienced unfair treatment in healthcare compared to just 3% of white men. And for women of color, the statistics are even worse.
Experts say there are things you can do before your appointment to help ensure you're being heard. The Society to Improve Diagnosis in Medicine recommends you have your medical history on hand, monitor and record your symptoms, and make a list of what you'd like to address with your doctor.
Well, friends, we hope you're having a great evening and enjoy this live view from our Mount Bigelow camera. We hope you also have a great New Year's Eve and a great New Year's Day. But hey, if you want to see us before then, we will see you live on 13 News Live at 10 for more of your local news and weather. Until then, have a great evening.